The nitrous oxide system has been placed into service in A2. It is stored in the red StatPack bag in the rear driver's side compartment, upper shelf. Security tags have been placed on the zippers and should not be broken unless using the system. Let's review the nitrous system. AEMTs, EMTIs, and paramedics are authorized to use the nitrous oxide system. It is a colorless gas with a slightly sweet odor. It's also known as laughing gas. It's heavier than air and is non-explosive and non-flammable, but like oxygen, it supports combustion and should not be used near an open flame. Nitrous oxide is a CNS depressant, dulls the senses, blunts perception of painful stimuli, and produces a carefree attitude about one's surroundings. It has an onset of action and duration of action of 2 to 5 minutes. The Nitronox system we have uses a demand valve and is not free-flowing like oxygen from a mask. It requires a breath to activate. It is indicated for use in isolated fractures, sprains, and amputations, otherwise known as an isolated orthopedic injury. Soft tissue injuries, including burns, are also indicated, as well as back pain and kidney stone type pain. Nitrous oxide may be used for pain management prior to IV access being established. It is contraindicated in patients with any altered mental status, psychiatric or behavioral disorders, pregnancy, recent ingestion of alcohol or illicit drugs, COPD, suspected bowel obstruction, and suspected cardiac-related chest pain. Nitrous is also contraindicated in head, facial, or chest traumatic injuries. Nitrous oxide is self-administered by the patient. EMS providers must not assist the patient in holding the mask. The patient must remain in direct control of the mask. In the event they breathe too much, the patient will be unable to continue administering the nitrous. To access the Nitronox system, break the security tag to access the bag. Turn on the oxygen cylinder and check the regular gauge to make sure it's above 500 psi. Turn on the nitrous oxide cylinder. If leaking occurs, the connection valve may need to be retightened. Check the gauge on the top of the Nitronox regulator to be sure that it is in the green zone. Pass the tubing through the opening in the top of the bag and close the bag. The Nitronox system is now ready for use. It's important that the bag remain in an upright position when the system is in use. To discontinue use, shut off the O2 valve and the nitrous valve. The system may be bled out by opening the O2 regulator to 25 liters per minute until the system is empty. Place the face mask in the utility sink at the station for cleaning. Document use on the message board so the system can be checked by the day crew. The system supports multiple patient use. An additional face mask is placed in the bag.